you through another session on a congenital left LV inflow obstructions, and I think it's a good idea to kind of subscribe the channel because you would be notified if I post a new video on this. We know that LV inflow obstruction can happen in the pulmonary vein, which we already had a previous YouTube video. You can go to that. And today I think I would discuss with you Cortriatratum. We call it Cortriatratum Sinister because it's on the left side, and the place of a membrane should be below the pulmonary vein and above the left atrial appendage, and that's where the Cortriatratum Sinister happens. You can have that just above the left atrial appendage, and these are the pulmonary veins which are draining, and that membrane could be obstructive or non-obstructive. But as compared to a supramitral ring, which is actually at the level of the mitral annulus, and it is distal to the left atrial appendage. Going to show you an example of Cortriatratum Sinister, and you can see this is the right ventricle, this is the right atrium, both are dilated. You can see a large ASD, and you can see the pulmonary vein here, and here you can see a kind of a membrane. The left ventricle is normal. You can see this membrane, and here you saw that membrane had a large hole which was non-obstructive, and you see another pulmonary vein here. So that's the pulmonary vein, and that's the membrane. There is slight increase in the flow across the membrane, but it isn't much. But there is a large torrential flow which is left to right at the level of an ASD. So this is a non-obstructive membrane which we call as a Loeffler group 2, and that's in the fetus. You can see the liver. There is an ascites. So there was fetus hydrops. This is the right atrium and right ventricle which were enlarged. There was a tachycardia, and the left-sided structures here are not very clearly seen. But on the next video, you see the tricuspid regurgitation, and you see the flow liaising somewhere in LA and LV. Let us find out further. Here you can see that there is a thick membrane. This is the left atrium, mitral valve, the left ventricle, right atrium which is dilated, the tricuspid valve, and this is the fossa ovalis. And beyond the fossa ovalis in the left atrium, you see a partition of the left atrium, and that is what is a Cortriatratum membrane. And on a color Doppler interrogation, you can see the pulmonary vein draining into the left atrium, and you see an liaising or an increased velocity across the Cortriatratum sinister. We do have a classification in place for Cortriatratum. The Loeffler gave a very simple classification. You can have a Cortriatratum with no opening, and the pulmonary vein drain into LA and through fossa ovalis drain into the right atrium. And type 2, which is the commonest, one can have one or more fenestrations or openings in the Cortriatratum membrane, which is obstructive, produces features like mitral stenosis, and it produces pulmonary venous hypertension. Grade 3 is a single wide opening, like I showed you the case, which is non-obstructive. And then there is a deeper or a little more elaborate classification of a rarer types of Cortriatratum sinister. Type A is when all pulmonary veins drain into the proximal chamber. You have a membrane, there is no ASD. That's a typical variety, the commonest variety of a Cortriatratum sinister, which I showed you examples of. Second subtype, A subtype, is once you have a membrane but you have a ASD which is proximal. Again, this was the type which I showed you in my first case of Cortriatratum sinister. You can have a ASD which could be distal to the membrane, which is exceedingly rare. And type B is that the pulmonary veins actually end up draining into the coronary sinus, and there is a restrictive fossa ovalis from where the blood comes to. This is the type of a PVC where all pulmonary veins actually end up draining into the coronary sinus. Type C is the rarest type where you have an ASD and a membrane which is proximal to the opening of the pulmonary veins. Next type I am going to show you today is supravalvular or supramitral ring, and this ring actually happens at the level of the mitral annulus, and this is distal to the left atrial appendage. So left atrial appendage actually makes a distinction between a cortriatratum and a supramitral ring. In case the membrane is distal to the left atrial appendage, then it is supramitral ring. If it is proximal, then it is a cortriatratum dexter. I am showing you a case of about 26 weeks gestation, came for a fetal echocardiography. You have a left ventricle, right ventricle, you have a large VSD, and there is a large aorta overriding the VSD. But apart from that, you can see a membrane which is kind of there at the level of mitral annulus. Same membrane you can see very clearly at the level of the mitral annulus, not involving the mitral leaflets. This is what we call as a supramitral ring, which could produce a mitral stenosis. So thanks for being here with me to watch this video. I think it's a good idea to subscribe so that the moment I'm going to post a new one, you would be immediately notified. Bye till then, and happy learning.